Prostate cancer is the most common malignancy diagnosed in men, and many men will know either family members or friends who have received treatment for prostate cancer. It can also be the most confusing because there are a myriad of treatment options, and the way that we discuss treatment for prostate cancer is often dictated by staging system and risk categories, which are quite different than those that we use for other types of cancer. Prostate cancer is assigned to a risk category depending on 3 factors. Those factors are 1, the PSA, which is the results of a blood test. The second is the Gleason score, which is a score assigned depending on what the biopsy looks like underneath a microscope. And the third is the clinical examination, meaning what did your doctor appreciate when they were performing a physical exam. These 3 things are taken into consideration to assign patients into one of 3 categories, those being low risk, intermediate risk, or high risk. And these risk categories are important because they give us an idea of how aggressive the cancer may be. And understanding how aggressive the cancer may be really helps us define what are the optimal treatment options. In general, patients with prostate cancer have either surgical or radiation treatment options. But we are appreciating that there are some prostate cancers that may not even require treatment. And so that is what we call active surveillance. Because of all the treatment options available for prostate cancer, it is very important to meet with members of the urology, radiation oncology, and in some situations, the medical oncology team to discuss the optimal treatment for your case. Every individual is unique, and given that we have multiple options, our goal at consultation is to arrive at the best treatment for you, understanding that any treatment will have potential risks and side effects, but those risks and side effects are very, very different depending on what type of treatment is pursued. In addition, many patients have other health conditions, which can also help us arrive at the optimal treatment decision for them. Within radiation oncology, we have 2 means by which we use radiation to treat prostate cancer. The first is brachytherapy, meaning that radioactive seeds are placed directly in the prostate. The second is external beam radiation, and that entails radiation delivered externally over the course of several weeks. Our field of radiation oncology is constantly evolving. It was not too long ago that patients receiving external beam radiation treatment for prostate cancer were essentially treated with a box around their prostate. But we have very critical organs close to the prostate, and these being the bladder and the rectum. With modern advances, we are now able to shape radiation beams from a number of different angles, dozens of times, so that we can shape the radiation to ideally fit the contour of the prostate while minimizing any exposure to the rectum or the bladder. Technical advances are always occurring in radiation oncology, and recently we have an FDA-approved hydrogel, which allows us the ability to create even more space between the rectum and the prostate, thus allowing us to further spare the rectum from unnecessary radiation.